Hi, my name is Dr. Richard Antbring, and I'm a sport and exercise medicine consultant. I work in elite sport and private practice, as well as the NHS in London. I'd like to talk to you today about ankle sprains. Ankle sprains are very common injuries that most of us have at some point in our lives experienced. They often occur when we misstep, or for example, when we're really active in sport. There is often what we call an inversion of the foot, and we injure some of the ligaments on the outside of our foot. Now, the ligaments are incredibly important in keeping the bones of the foot stable, and often they're stretched in this manner and can suffer injury. The symptoms that one might experience if they sprain their ankle is often the immediate pain that's associated with it, as well as subsequent bruising and also often swelling. If it's a significant ankle sprain, it might even be difficult to walk after the injury. If there is a significant amount of swelling, as well as difficulty in walking, then often it's recommended to go see a healthcare professional, such as a sport and exercise medicine consultant. We will do a range of tests as well as ultrasound in the clinic to be able to look at the integrity of the ligaments that have been affected. We can also exclude more serious ankle sprains that might need surgery. After we've diagnosed the problem and explained to you what it is exactly that's happened, we're able to devise a treatment strategy for you that will get you back into physical activity as quickly as possible. This will often involve physical rehabilitation in the form of physiotherapy in order to strengthen some of the muscles of your foot, as well as protect your ligaments at the same time. Often, when patients or people injure their foot from an ankle sprain, there is a high risk of re-injury, and this is because we lose what we call proprioception, or our ability to sense where our foot is in relation to the ground. And this is something that we work hard on during physiotherapy as well, for you to regain in order for you to reduce your risk of re-injuring your ankle in the future. Should there be any difficulty in reducing the pain and swelling, we might recommend, for example, a steroid injection, which will help reduce the inflammation and help you get back to activity quicker. In summary, ankle sprains are incredibly common injuries, but with the right care, most people will recover well. It is important that whilst we initially rest the ankle, it's important that we then employ appropriate physiotherapy and rehabilitation regimen in order for you to reduce your re-injury risk, as well as get back into physical activity as quickly as possible.